Hello and welcome. Today we're diving deep into a condition affecting the urinary system called ureteropelvic junction obstruction, or UPJ obstruction. This mouthful simply refers to a blockage where the ureter, the tube that carries urine from the kidney, meets the renal pelvis, the funnel-like collecting system of the kidney. We'll explore what causes it, how it affects the body, and what can be done about it. So, what causes this obstruction? In many cases, UPJ obstruction is congenital, meaning individuals are born with it. This can stem from several developmental abnormalities. These include an abnormal arrangement or absence of the muscle cells in the ureter wall, kinks or folds in the ureter itself, or compression of the ureter by a blood vessel. Less commonly, UPJ obstruction can be acquired later in life due to scarring from previous infections, kidney stones, or even trauma to the area. Let's understand the pathophysiology. Imagine a bottleneck in a busy highway. Urine normally flowing freely from the kidney encounters this obstruction at the UPJ. As urine accumulates behind the blockage, it causes the renal pelvis to swell, a condition known as hydronephrosis. This pressure can eventually damage the kidney, impacting its ability to filter waste effectively. If left untreated, prolonged hydronephrosis can lead to permanent kidney damage and even kidney failure. UPJ obstruction affects people of all ages but is most frequently diagnosed in infancy and childhood. It's estimated that about 1 in 500 babies are born with UPJ obstruction. Interestingly, it's slightly more common in males than females. While congenital cases are prominent in pediatric populations, acquired cases can occur in adults, often associated with conditions like kidney stones or prior urinary tract infections. The signs and symptoms of UPJ obstruction can vary depending on the severity and age of onset. In newborns and infants, it might be detected during prenatal ultrasounds as hydronephrosis. Older children and adults may experience intermittent flank pain, often described as a dull ache in the back or side, especially after drinking large amounts of fluid. Other symptoms can include urinary tract infections, kidney stones, nausea, vomiting, and even high blood pressure in some cases. Some individuals may have no noticeable symptoms at all, and the obstruction is discovered incidentally during imaging for another reason. Diagnosing UPJ obstruction involves a combination of imaging and functional tests. Ultrasound is often the first step, as it can readily detect hydronephrosis. A diuretic renal scan, also known as a MEG3 scan, provides valuable information about kidney function and urine drainage. This involves injecting a radioactive tracer that is filtered by the kidneys, allowing doctors to assess how quickly urine passes through the urinary system. Other imaging techniques like CT scans or MRI scans may be used to visualize the UPJ and identify any underlying causes of the obstruction, such as a crossing blood vessel. While there aren't distinct types of UPJ obstruction, it's useful to classify them based on severity. This is usually done using grading scales based on the degree of hydronephrosis seen on imaging. Grades range from mild to severe, with higher grades indicating more significant kidney swelling and potentially greater risk of damage. This grading helps guide treatment decisions. The primary goal of treatment is to relieve the obstruction and preserve kidney function. Mild cases, especially in children, may be managed with observation and periodic monitoring to see if the obstruction resolves on its own. More severe cases, or those causing significant symptoms, typically require surgery. The gold standard surgical treatment is pyeloplasty, where the obstructed portion of the ureter is removed and the healthy ureter is reconnected to the renal pelvis. This can be performed through open surgery, laparoscopically, or robotically, depending on the surgeon's expertise and the patient's specific situation. In some cases, a temporary stent may be placed in the ureter to help with drainage during the healing process. Unfortunately, there's no definitive way to prevent congenital UPJ obstruction, as it often arises from developmental factors. However, maintaining good hydration, promptly treating urinary tract infections, and managing kidney stones can help prevent acquired cases. Regular check-ups, especially for individuals with a family history of urinary tract abnormalities, may also aid in early detection. The prognosis for UPJ obstruction is generally good, especially with timely diagnosis and treatment. Pyeloplasty is a highly successful procedure, with success rates exceeding 90%. Most individuals experience significant symptom relief and improvement in kidney function after surgery. Ongoing research is focused on less invasive diagnostic techniques, refined surgical approaches like robotic surgery, and a better understanding of the genetic factors contributing to congenital UPJ obstruction. These advancements promise even better outcomes for patients in the future. Thank you for joining us on this exploration of UPJ obstruction.